including being overweight. So, scientifically, you cannot drink alkaline water and it makes your cells alkalytic. The closer you are to nature, the healthier you'll be.
Hello, and happy Saturday. I am Carolyn, and you are in the Mind of Nature, hosted by Dr. Zarif, the nutritionist. Come on in, and share the live. Go ahead and share the live. We are live on Facebook, on YouTube, and on Instagram. So come on in. We have a great show lined up, as always. We are going to be discussing a few topics today, issues that affect Black people. Now, we all know that we've definitely got some issues that affect us. So we want to hear about those. UTI, natural UTI treatments that don't work. And also what you can do to prevent chronic conditions. Always a great information. And then small steps for big results. So please, as you're coming in, share the live. We encourage you to share the live, have others come along and be a part of the conversation. So Dr. Zarif, go ahead and join me here so we can get started. How are you? How are you?
Wonderful, wonderful as can be. I am looking forward to another beautiful show of sharing. It's educational, something that we can put into motion right away. And hey, we're looking at 2026 now.
Mm-hmm.
I mean, that time is incredible. If you've been using your time in a constructive way, you've gotten a lot of stuff done through the year. And if you haven't, it's time to just change that now because time waits for no one. So get it done. We're going to be talking about these issues as we want you to keep in mind what's happening in your family, what's happening in your tribe, what's happening in your village. This isn't just about you. This is about building you up initially so that you'll have enough, some surplus,
Mm-hmm.
like Ian Van Zant said, whatever's running over from the cup, that's what you share. And in order to run over, you must acquire the knowledge for it. And that's what we're here to do. So we're looking forward to having a great time today.
Absolutely. Absolutely. I want to say, excuse me, really quickly, excuse me, Ugh, apples. Got
Well,
me right here.
you're eating the right thing. That's
Allison Gentle, good morning.
yay.
Good morning. He said we are waiting on Dr. Farid Zarif. He is here. He is here. Okay.
Oh man, it's great to be here. Thank you so much, Mr. Gentle.
Sherry G. Smart. Good morning. Good morning.
Woo-hoo.
Charlie, hello. Good morning, and good morning to you. Please go ahead and share the live. Thank you guys so much for joining us. We are live again on Facebook, on YouTube, and on Instagram.
Let's go ahead and get into it. We're going to talk about some of the unique issues that Black people are affected by, and those things that we want to change. One of the things that I want to express to you is that there are a lot of beliefs in our community, and those beliefs can be they can be popular or they can be unpopular. If they're not popular, people don't really talk about them that much. But some of the things that are popular is like, I don't want to take that vaccine. I don't know what's in it and all those things. And we continue to reiterate how important it is to know why. Why are people still withdrawing from getting a vaccine? Why people are saying to themselves that, or sharing with others that, you're not putting that stuff in my baby or my body and all that, because we have a terrible history of being abused and experimented on as Black people as a whole. So it's really understandable why people take that disposition. And there are other situations that maybe somebody in your family or somebody else's family was doing better when they came to the hospital than when they left, and some didn't even leave. And that is in itself something, of course, not to be upset with another person about, like, oh, you think you too good to, you always got to complain about something. Those kinds of things, we have to stomp those things out. We have to get rid of those things. Okay. I don't want to sound so violent, but the naturally disease and responses to treatment, they do vary from person to person, and we know that, and that's called the biochemical individuality. But they are unique issues that affect Black Americans. And we start off with diabetes, because diabetes, it just keeps getting worse. It keeps on and on. It gets worse, like 60% more common in Blacks than in whites, for instance. Blacks are up to 2.5 times more likely to suffer a limb amputation. And for those who don't know, that's the removement of one of your limbs, a leg, or it can be your arm also. And up to about 5.6 times more likely to suffer kidney disease than other people with diabetes. Blacks also, and if you prefer African American, do your thing on it, but don't miss the blessing. The blessing is the education. Blacks have twice as much the risk of diabetes as whites. In addition, Blacks with diabetes have more serious complications such as loss of vision, loss of limbs, and kidney failure than whites. Now, the theory is that maybe it is a access to healthcare, excuse me, or maybe a cultural fatalism. You know, thinking that things like is it God's will, or it might be one of those things like a phrase like my family had it, my family had it, so I have to have it too. Um, Not since a long time. I mean, people have been doing that forever. Like if Aunt Shirley was had this, or cousin Franco had that, and I got to get it too. It's not necessarily so. Indeed, there's evidence that Blacks that have a genetic susceptibility to diabetes, we know that, but it's not necessarily so that you will have it automatically. You will get these particular ailments and diseases automatically. Even so, the real problem is empowering patients, friends, relatives to keep their diabetes under control, since patients often just have a sense that they are not as much in charge in managing their diabetes as their doctor. So they feel that they'll have people that know about more about medicine and taking care of their body. And many times they feel that they are not understanding it enough to take care of themselves. Okay, so as we move along here, um, it's easy to say to people, especially with diabetes, that they should learn like how to control their disease. Now, but the tools for this kind of self empowerment often aren't available in Black neighborhoods or Black schools or Black businesses. Is not the same. You can even look at the schools, and if you followed our history, segregation was all about the Black people going to the same schools and having the same opportunities as white people. However, if you are a student of our history, you also know that most of those people in those schools that were integrated, they left those schools. They left that property. They left that neighborhood, that community, because they felt like it was that bad that Black people, first of all, should not have um, the opportunity to know as much as them. And another crazy and ominous thought that these people had is also, and you have people today the same way. So I don't want to act like I'm hiding something. You know, they have people today that don't feel that we deserve to know more or as much as they do. So this is something that we're dealing with constantly, and as we continue to get more information, we'll find out that these things are not acceptable. These things are, for the most part, they don't have to even exist, but we have to speak out. We can't be silent, sitting on our buttons and saying that this is somebody else's problem. I want to go to asthma now. That was diabetes, but when we get to asthma, the death reflected a harsh reality in the United States, and this is like asthma was not a particularly hard disease or disorder to um, have people even think about it. But asthma, when it hits the African Americans, particularly hard, and the healthcare system often fails them, then it's really, really hard. And I say them, I mean me too, um, because about an estimated 15.3% of Black children have the disease, compared to 7.1 percent of white children. See, and it sounds like when I say white, Black, automatically we just jump to conclusions that it's a white thing, it's a Black thing. No, it's a people thing. And there aren't people there are people that actually think that they're better than anybody, and that they're not like anybody else on the planet, and that eugenics really hit people very hard. And the studying of how Hitler dealt with things, and how Mussolini dealt with things, how Trump is dealing with things, Hitler is dealing with things. All of these are uh, very, very good examples of what happens when people are racist, and we don't do things about it. Overall, African Americans are nearly 3 times as likely to die from asthma than white people. 3 times, uh, nearly 3 times as the risk is higher in Black people. So yeah, I hear people when they say people aren't people, we're the same thing, we bleed red blood the same way and all that. Yeah, okay, I don't take anything from you from that, but to understand the biochemical individuality, there are propensities in our communities of having different diseases, a greater chance, a greater risk of having certain diseases. Some of these diseases we have no way or of knowing, or we don't know how that is so. However, we do know, since it does occur in our community, that we can definitely do something about it. There's another deadly disease, and it's called sarcoidosis. And some people pronounce it differently, but like they'll say sarcoidosis. But sarcoidosis, you may not have even heard of it that much. But if I mention people like Bernie Mac, for instance, or remember 43-year-old Reggie White that played in the NFL, he was a star. And then, today, uh, currently Tisha Campbell. All of them have. had struggles with and still are having struggles with the lung scarring. That's what sarcoidosis is. And the lung scarring are 3 times more likely among blacks than among whites. This is ridiculous. 16 times more. Well, see, we might not even be able to do anything about this as far as, biologically, physiologically, and even maybe even as far as psychologically. So a lot of times when it looks like we have a shortage of things or a shortage of answers, then it just means that we got to dig a little deeper, not give up. Speaking about lung scarring, we go to like lung cancer. In 2005, a report from the American Lung Association showed that Black Americans suffer far more lung disease than whites do. Now, despite lower tobacco exposure, Black men are 50% more likely than white men to get lung cancer. 50%. Now, I know you might not be able to just imagine that when you smoke, your risk of getting something is 50% more than someone else. Blacks have more asthma than any racial or ethnic group in America. And blacks are 3 times more likely to die from asthma than whites. Blacks are 3 times more likely to suffer sarcoidosis than white Americans, and lung scarring, that which again is a lung scarring disease, is 16 times more deadly for blacks than in whites. Blacks are 50% more likely to get lung cancer than white men, and blacks have half as there's half as likely to get the flu and pneumonia and vaccinations than white Americans. I'll say that again. Blacks are half as likely to get flu or pneumonia vaccinations than white people. And keep in mind that this is they're half as likely to get it. Don't not the other way around. No, so you might say why? Well, there are a couple of reasons for this. There is 71% of blacks versus 58% of white Americans. They live in communities that violate federal air pollution standards. So if we live in black neighborhoods, like you have different, especially here in California, there's fracking in some areas, and those areas now are predominantly black people. There are areas where people get a certain kind of water, for instance, or there might be other air pollution problems around foundries, other things like, different factories that produce this waste. Now, the environment is involved, and there is potential genetic susceptibility, but we also have to talk about the fact that blacks' social and economic status, it lags behind the Caucasians, and this low socioeconomic status is linked to more disease because we have a less chance, a greater risk of the disease, and a less chance of overcoming it. So we need the money in place too, and we're thankful for those people that go deep in their pockets to help us there. You have heart disease, cancer, and other diseases also that we can talk about. But I want to just talk about one thing that we know for sure is that strokes. Now, stroke is something that we don't look at, especially if you're 40s, even 50 years old. You're like not worried about it. But as you get older, you do increase the chances of stroke. Stroke kills 4 times more 35 to 54-year-old Black Americans than white Americans. And Blacks have nearly twice the first time stroke risk as whites. You see? Black Americans have a higher prevalence of stroke and a higher death rate from stroke than any other racial group. That's our difference. So when we talk about how unique we are, we got to look at also some of the things that we can do that are constructive, not just, just because you're Black. Now, stroke is a brain attack. That's what the stroke is. It's actually a brain attack that most often occurs when the blood that brings the oxygen to your brain, it stops flowing and the brain cells die. So imagine all the energy and all of the oxygen coming to the brain, and then something happens in the body that actually impedes, it interrupts the flow of oxygen. So this is very serious disease. Black stroke survivors are significantly less likely to be treated for many complications, including fatigue, spasticity, depression. All of this compared with white stroke survivors. Now, it is very important to make a list of these things. Well, with cancer, there's some of the things that I would just want you to be aware of, because African Americans have a higher rate of getting or dying from many types of cancer, and these cancers improve prostate cancer. Black men are twice as likely to die from prostate cancer than non-Hispanic white men, and then we have breast cancer. Black women are almost 40% more likely to die from breast cancer than non-Hispanic white women. In 2019, breast cancer became the leading cause of cancer death for Black women, surpassing lung cancer. And that's huge, because when we look at lung cancer, lung cancer has been in number one place for fatalities for like over or nearly a century now. Stomach cancer, when it comes to stomach cancer, Black women are twice as likely to be diagnosed with stomach cancer and 2.3 times more likely to die from it than non-Hispanic white women. Black men also have a double risk of death from stomach cancer. Now, the endometrium cancer, Black women have double the mortality rate for endometrial cancer. So, these are some that you can be aware of. And I think I should give an honorable mention to sickle cell anemia. Just because it didn't make it to the main list, it doesn't mean that we shouldn't pay attention to the alarming statistics ravaging our Black communities. Now, by now, you probably know that is a um, sickle cell anemia affects Black far more than it does whites, and it's clearly uh, well, I should say it is clearly that it's genetic. It's a genetic disease that has little to do with the environment. Yet, even here, with a killer disease, social and political issues still come into play. Sickle cell anemia has been known since 1950s, but for many of these generations, the sickle cell anemia has not had the funding, and it has not had the research, and it has not had the attention that's needed and that it deserves to reduce the risk of sickle cell anemia in Black people. Okay, we're going to go back up to care.
Thank you so much. Thank you so much for that, Dr. Zarif. And I think what we're doing here is you just mentioned that there's not enough attention. So that's a part of what we're doing here is bringing the attention to these diseases that affect the Black community, but just doesn't have that kind of attention. So that's why when we say, please go ahead and share, drop comments, let us know what's on your mind, your thoughts, and those kind of things. That helps to get the word out even more with what Dr. Zarif is sharing with us, because this is really great information that you're sharing. Something else that came to my mind also, Dr. Zarif, is lupus. I don't know if you mentioned that as well, but that's also in that category of diseases that affect the Black community as well.
Yes, indeed. There are many other diseases, as a matter of fact, but those are just some that made the top 10
Yeah.
list. But yeah, you're absolutely right. There are many types of lupus, for instance. Systemic fibrosis. You have colorectal cancer. It goes on and on.
Yes.
And I didn't. I also didn't mention the Black men and Black men with breast cancer, and that's also something that we should keep in mind and don't be relaxed. One of the things, Gary, is that I see in Black folks, not just Black folks, but I think just people in general. Once we find something, if there's a disease, and people, for instance, just here recently, when there's a more what is the name of that particular? There's a disease that when people, well, let's just take AIDS for instance. And let's
Mhm.
go right to when a person finds out that there is a medication that a person can take, and they during them taking this medication, they can't detect that that person has HIV. You would think that a person says, "Oh man, that's great. My body will act differently. I'll have better health," or something along those lines. But instead, you have most of those people that have, and this is just through the information, is through the observance of different Q&As, different ways that people will reply to certain things during the survey. And it comes out that many people are happy to have those particular options, and that particular option would be that medication. But they'll say, "Oh, you know what? Shoot, I can do it without a rubber now. I don't have to be as safe." So there are many things like you will see when you help a person. For instance, in my case, if I'm like, "We worked hard, we got you together. Keep up the good work. Continue to comply."
Mhm.
But the reality of that is when a person feels good about what they're eating or drinking, although that made them sick at one point, they'll go back to eat that particular certain those certain drink or that certain food, and it's like, oh well, you got to die from something, and so that is the ignorant bull crap that I just definitely don't like to hear, because you have people that will get heart surgery, they would get lung surgery, they would get a serious surgery, and then they would go out, they'll still eat a triple cheeseburger,
Mhm.
or the person that I had a colleague of mine. He is a oncologist, and he, after a operation, he had was the guy's operation went 11 hours, and it was something very difficult. However, he saved the guy, and when he woke him up from his anesthesia, he looked at the doctor, and then he said, "Doc, can after they asked him all the questions and all that stuff and make sure he's conscious, and he put his fingers up to his mouth like that, and he said, "Doc, is it all right if I?"
Mm.
And he had just that's the kind of pitiful ways that people think. And you would think also that people, once you start taking care of your body, that and you got it is feeling good and you're strong, that you would, yeah, I want to take care of myself.
Yes.
You have people that are like, oh man, you got to die from something. What the hell are you talking about? You looking for something to die from? It's ridiculous just waiting around to die.
Mm. Yes, it is. Thank you so much for that, Dr. Zari.
Oh yeah, by all means. I want to say thank you for being here. Kathy Belmar is in the house. Sarah, I think is I'll just say Sarah Framsack, something like that. And these names are incredible. And the Sita Mayana. Okay, I'm sure that could be more beautiful than how I'm pronouncing it. But I want to welcome you all. Thank you very much for being here, and everybody that's here on Facebook. Thank you very much for being here, along with those that are also on YouTube.
Absolutely. You
All
ready
right.
for the next one?
I am ready and to go with it. Here we go. So let's talk about a little bit about this is on the rise in this UTIs. UTIs are urinary tract infections, also called a bladder infection. And it starts with the bacteria that gets into your bladder and your kidneys or another part of your urinary tract. The best way to treat the UTI and to relieve symptoms like pain, burning, and an urgent need to, I'll just say, urinate. Usually you'll hear people wear out pee. So anyway, so if you again want to relieve the symptoms of pain and the burning and an urgent need to urinate, is with antibiotics. Now these actually medications, they actually kill the bacteria, and I know some people say things like, let me get back over here where I'm supposed to be. Yeah, some people will say things like, I take vitamin C because I would, um, they'll use acid. So acidify their what they think they're acidifying the situation, meaning that the acid that they're going to make from vitamin C and other citric fruit has been known to kill the bacteria. But the truth of the matter is that even if it did kill the bacteria, how would you know? You don't know. There's different types of, like Shigella, there's Salmonella, there's E. coli. There's different so-called bad bacteria that can be killed by some, can be killed by some of the things that we do, like some people take the uva or erva ursi, and erva ursi is a herb, and is also known for helping relieve you of some of the symptoms when it comes to UTIs. But here we go again. I just want to make sure that you know that the UTIs, unless you know the exact what type of bacteria you're killing and how to get to it and what to take. The best thing right now for you to take are the antibiotics that are very effective, and you shouldn't play around with this. Not to say that you know you're not responsible, but you should have some idea of what you're taking and how is effective or if it's not effective. But don't just take some fruit or something and then think that you're going to overcome the certain symptoms that you're having with a UTI. Okay, UTI also, these medications, they kill bacteria that cause the infection. The very cause of that UTI will be, or is usually, the bacteria that cause the infection. It's important to take them just as they're prescribed. Don't put your twist on it, because this is what you have when you want people to comply. They're okay, okay, yeah, I got it. Okay, good, I'll take it. And then they'll go to the pharmacy, and the pharmacy will give them the same. Yeah, you do it like that. Okay, yeah, the doctor already told me that. But a minor UTI can turn into a serious kidney or blood infection if you don't, which the antibiotic that you get, and how long you take it depends on your urine test results. So you'll get a checkup when you go to your urologist. Urologist will check your urine for the contents, or the composition of your urine, to make sure that um, you're healthy. And if you're not, that your physician should tell you what to do. But you definitely want to get rid of all of the pain, and you don't want to have it at any length of time, because you want to get rid of it, because it can definitely cause problems. Some of the things that, there are a lot of the different antibiotics, and the your doctor will tell you to take a urine sample to confer that you have the UTI first. Because there's other things that could be happening there. And then there's a lab that will grow the germs in the dish, and that'll take a couple of days to find out which type of bacteria that you have. I just mentioned knowing the type of bacteria makes a huge difference. Now, that particular process actually is called a culture. uh, it'll tell your doctor like what types of germs cause the infection, and they'll likely prescribe one of the following antibiotics, and also it would help treat it before the culture comes back. Some things like ceftriaxone, and then there's trephylexin. These are the doxycycline. All of these are, and there's more that you can take, that you probably heard, Bactrim and Bactrim DS. All of those are some of the uh, pharmaceuticals that are used for the UTIs. Now, UTIs, they also, you might hear the language like complicated versus uncomplicated UTI, which the medication and dose that you get, also depends on whether your infection is complicated or if it's uncomplicated. So let's look at the uncomplicated. Uncomplicated just means that your urinary tract is normal and that you are otherwise healthy. That's uncomplicated, and this makes UTI easy to treat. But the complicated means that there is another condition that makes your UTI harder to treat. It's almost like a comorbidity. It's another. So the complicated. Remember, just like the defining complication would be apropos for the description of what you're experiencing. And complicated means there is another complication that makes your UTI harder to treat. Now, you might have a complicated UTI if you're pregnant, or if you have recurring UTIs that can't be controlled with the typical antibiotics. The problems with the kidney function that can happen because, again, going to making the changes would happen in your body. For instance, higher blood pressure when you're holding your when you're not voiding or emptying your bladder. You can definitely cause other problems. If you cause bladder problems, that also puts pressure on your kidneys. And if you do not change that, or if you do not arrest that particular problem, it can lead to greater problems like end stage kidney disease. So we're going to go back to the wonderful Carolyn as we continue. You're in the mind of nature.
Thank you. Thank you so much, Dr. Zari. I appreciate that. It's great whenever you mention, because we are about natural, you know, um, supplements. We are about natural, right? However, I'm happy that you're saying, that when there are times when we go with natural and other times when we go for the medication, especially when it's something like you said, like a UTI, something that can cause, or if it's not treated, turn into something else. You don't play with that. You don't, wait around and say, oh, I'm going to take this herb now, or whatever the case may be, and it's all going to go away, because there are times when you actually have to take it up a notch. And yeah, and I've always said, the natural way, I think, is for like preventative. Now, when you've already gotten, or that thing has happened, you go for the medication. This is just my thought on this. You go for the medication, the thing that is created to get rid of that thing, and preventative, natural, and when that thing has happened, you go for the medication. That's my thought on that.
Well, I mean, it's very important, and you really express a very important point that you should never play around or self medicate. That's something that can be to your disadvantage. There are people that have taken over 10,000 hours of practice and study and schooling and all of that. It's the same thing as if you take your car to get repaired, and you see all that stuff under the hood, and some people never even seen under their hood, especially ladies, because they're like, I'll let somebody else do that. They're females do female stuff, or I should say, women do women stuff.
Hmm.
So yeah, that's really important, that people don't self medicate. There are so many people with a first aid kit, and they act like they're going in surgery when they, and some of it is coming from a good place.
Yes.
You always want to, like, I want to make sure that so and so is okay, or you take care of your children, and all of that is first aid,
Hmm.
and that's great first aid. But it's to when it comes to putting things in your body, like you're taking certain pills and capsules and all that. It's a good idea to know the amount, the dosage, and the side effects, and where it comes from, and how it reacts in the body in general or specifically. So these are some of the things that will help us to understand when it comes to that time when we need to put more in our or put more time into finding out what we're putting in our bodies.
Yes, absolutely.
Yeah. So we have some comments here.
No, no comments. No,
Oh, okay. All right.
we can continue on.
All right. Well, let's get on, everybody. We're almost there, and I want to go into what you can do to prevent some of the chronic conditions. And a chronic condition is when you have something for a long time, and it becomes it accrues, it turns into something else, and then something else real very dangerous. So let's just take a look at, what how do you prevent chronic diseases. And chronic is also different than acute. Acute is something that maybe you bump your toe and ooh, that hurts. That's acute. But something like, even if you were to, in some kind of way you fall or you slide into second base and your knees hit the ground hard and it scrapes up your body, and that's acute. But a chronic disease are those diseases that's going to be around for, they have a longer time, and they really amount to something that um, really can be a great challenge to the way that you feel, or the way that you connect with life itself. There's no game with it. This is your life. Keeping regular checkups is one of the things that I talk about constantly, and you do that with your primary care physician. Also, the PCP. When you hear PCP, that's what that acronym is referring to. And if you have one, if you have, like one like a PCP, that can help you to stay ahead of potential health issues, that's what you want to do. Just because you're not going to the hospital doesn't mean you can't call. You can call the hospital, talk to a nurse practitioner. You can talk to, see if you can reach your doctor. Now you can, there's telemed, so you can go right on to make an appointment. You don't even have to leave the house anymore. But beyond that, creating a healthy lifestyle habits, it can go a long way in improving your health. Now, some of the simple things to do, as far as preventing your chronic condition, would be to decrease any alcohol use or eliminate it altogether, to stop using that, or having the potential to drink more. So, for especially some people that are sensitive to alcohol, um, and stop using tobacco altogether. Just, you shouldn't be, stop using that altogether. Now, some people will say, "No, I'm going to smoke my cigars and pipes and all that stuff." Well, I'm just letting you know that you're doing your body a disservice when you do. Another thing that you can keep in mind is to improve your meal plan, incorporating more fruit and vegetables, and cutting out the processed food. And that is a continuum of effort. I'm not going to say that it's easy. I find myself struggling sometimes too. I'm like, God, what else can I? And then I have to, I uh, look at the all the different types of things. I'll go and what the other thing that's great about it is that you can also look at take more time and look at different types of cuisine, and this will expand your scope when it comes to what you want to prepare to eat. There's all kinds of food channels. There's, of course, you can travel, but you can easily get menus right off of online, and you get things like that going on. But improve your diet altogether, and incorporate more fruits and vegetables. And also, you want to um, limit the non-sweetened beverages, and switching to your sugar-free alternatives. Now, the tricky thing about the sugar in non-sugar, or no sugar, or sugar-free, is that sometimes, and what you'll see is, it'll be, for instance, let's say xylitol. And xylitol is an alcohol sugar, is not like some of the quote unquote natural sugars, like honey, or just, sugar cane. And it might be a little different there, but the processed fruits, the processed vegetables, they can be sugar too. The name of the sugar can change just so they can market their products in a certain way. But when you already know you're getting this information, put it into action. You want to use that 800 number on the labels too. If you're not sure about it, I need to speak to someone, and you don't want to speak to the first person to answer the phone because it's most likely the receptionist, but you want to speak to one of the scientists. You want to speak to a person that has knowledge of the product, what's in it, and how it affects the body, those kinds of things. You also want to increase your exercise. I always talk about that. You don't have to commit to intense workouts, multiple especially multiple times a week, especially if you're just getting started. You want to get reacquainted with the physical activity. You want to take your time. You don't have to do the deepest squat, drop it hot, drop it like it's hot squat. You do everything little by little and you take your time. But the important thing here, everybody, is to be consistent. Don't do it once last month and you haven't done it yet. Again, so you do want to do things that will help you um, to work out. And again, you can have a low intensity to no intensity because you can also go into the water and take all of that off you. Look, I love this information because I love my people. And when it comes to us eating certain foods and still calling ourselves queens and kings, do not eat slop, period. And you have some of us that eat anything and everything, and we blame that stuff we'll blame it like on our families and say things like they've always eaten like this. But preventing your chronic diseases takes time, it takes the commitment, and it takes wanting to know more about diabetes, hypertension, chronic disease, heart attack, chronic obesity, that's glucose, hypertension, all of those things. So keep that in mind. Find out more about it. Just don't say, I think I got such and such a thing. And if you're fortunate and you have a doctor in the family, you call that doctor. You don't want to worry him and run him or her away, but utilize that. Utilize that. You have to take advantage of that. And you have a lot of brilliant doctors, RNs, that are just incredibly brilliant, like Cheryl Lee Smart, for instance, brilliant, brilliant, and these are the kinds of opportunities you want to acknowledge. We're going to go back up to Kara. Kara, coming in back up to you.
All right. Thank you so much, Dr. Zarif. Whoop, whoop. I always got to give you the whoop, whoop, whoop.
I like it. I like it.
Really do appreciate it. Thank you all so much for joining us here. We're actually not done. Sorry. I'm about to do the sign off, huh? But we are live on Facebook, on YouTube, and Instagram. So thank you all for sharing. We appreciate it. If you have any questions about any of the topics that Dr. Zarif has gone over so far, go ahead and drop them in the comments. So just so you know, you are welcome to do that. So great information as always, Dr. Zarif. You want to go ahead and continue on?
By all means. We were just talking about, how people eat, and I'm just taking a little more time on that so you get a better idea. I want people to focus on a balanced way of eating, and this means a little bit from each group. That's balance. In other words, if you're eating fruit and you're eating all fruit, that's good for maybe a salad or something in the morning. But if you're eating fruit and then you have nothing but that, and you got bread or you got rice and fruit and some mixture, wild, outlandish plate of food, that is unbalanced. But balance, you want to keep in mind, you got a little bit, and we know about protein. You know, the first thing when we say protein, we think about a steak or something like that. We usually don't think about what the cattle was eating. We think more about, oh man, the cattle had to die in order for it to be this piece of meat. So you will also hear that in lean proteins. This they'll call it lean proteins. Your steak and other different cuts of an animal. So I don't think that it'll be changing anytime soon as far as meat is concerned. But I can say this, that meat has been categorized as unhealthy for the human body. And this is by CDC, NIH, and other different USDA, not so much, but the reports that we get from some of the experts can be very, very interesting. The Along with that, you want to limit again your processed foods, mostly your read it, refined sugar, refined flour. When it's refined, processed foods don't really, they use that interchangeably with the refined foods. But we won't make a big thing out of it right now, but just be aware of that and the sugars and along with the saturated fats. Remember, saturated fats are what? The oils that actually solidify at room temperature. Let's go on to regular physical activity. Aim for at least 150 minutes of moderate aerobic exercise weekly. I would just break it down like this. Every time you exercise, see if you can just cut out a 45-minute period for you just to do your thing. And that's just moving. As long as you're moving your body, it's going to take calories to do that. Regular physical activity is very, very important. It makes a huge difference in what's happening with your body. Include strength training exercises at least twice a week. Avoid tobacco and the alcohol, as I just repeated it because it's that important. Routine checkups. I can't say that enough. Make sure that you schedule regular visits to your healthcare professionals for screenings and vaccinations. That's on you to figure out if you're going to avoid the vaccination. But if you know anything about the OBGYNs to tell you, although there are other professionals too, but OGBYN can tell you why a child is vaccinated when the child comes into the earth. Very, very important. And with that, everybody, I want to say thank you for coming and being here today. These were some of the deadliest diseases in the Black community. Back to care.
Yes, thank you so much, Dr. Zarif. Again, thank you all so much for joining us. Denise Kane, good morning to you. Thank you so much
Hey,
for joining us here today in the Mind of Nature. Dr. James Thompson, hello,
hey.
hello. How are you? Good to see you. Thank you again so much for joining us here today. We are live every Saturday, 8 a.m. Pacific time here on the Mind of Nature. So, again, thank you all so much for commenting, for sharing, for kicking it with us.
Yeah, yeah, we're gonna have Dr. James. When you can, let me know when you're gonna be available to come on our show. I want to feature you. That'll be really great. That'll be a great show. So give me a call when you can.
Absolutely.
All right. Now, everybody, now let's go and put this stuff to use. I mean, we've heard about it. Talk, 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 talk. And sometimes, you know what? Talking don't get it done. Talk therapy is important, but sometimes you have to take the next step. And I'm asking you to take the next step, and that's to take action on the things that we talked about today, which are very, very important. Get that physical activity. You cannot substitute it. Nobody else can do it for you.
Hmm.
Avoid, taking that, I know some people say, ooh, this cigar just tastes good. I like the way the experience. But don't fall for the okey doke and ruin your body and increase the risk of disease and infection. Okay. All right. Kara, I give you that last word, and thank you very much again for being here, everyone.
That is all I have. Just thank you all so much.
Sounds like a nice song. I think I'll go play it. All right, everybody. Thank you so much, and really appreciate it. Hi, Denise. And yeah, and I'm so always glad when Dr. James comes on. And he's been doing a lot of things. So we're going to get him on here so we can we got to share. We got to share the light, and that's what we're doing. Thank you so much. All right, everybody, have a beautiful one. I'm Dr. Zarif, the nutritionist.